Title: Cancer Immunotherapy, Indications, Mechanisms, and Adverse Effects. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at CoffeeFirstCup to receive generous discount codes. Introduction: Cancer immunotherapy has revolutionized cancer treatment by harnessing the power of the immune system to target and eliminate cancer cells. This essay explores various classes of cancer immunotherapy agents, including cytokines, monoclonal antibodies, immune checkpoint inhibitors, antibody-mediated tumor T-cell bridging therapies, CAR T-cells, and immune-enhancing oncolytic viruses. We delve into their indications, mechanisms of action, MOA, adverse effects, and miscellaneous considerations. A. Cytokines. Indications: cytokines like interleukins and interferons are used to stimulate the immune system to recognize and attack cancer cells. They may be indicated for certain types of cancer, including melanoma and renal cell carcinoma. MOA: cytokines activate immune cells such as T cells and natural killer cells to target cancer cells directly or indirectly. Adverse effects: common adverse effects include flu-like symptoms, fatigue, fever, and in severe cases, cytokine release syndrome, CRS, or capillary leak syndrome. B. Monoclonal antibodies. Indications: monoclonal antibodies are designed to target specific antigens expressed on cancer cell surfaces, facilitating immune recognition and destruction of cancer cells. MOA: these antibodies may work through various mechanisms, including direct targeting of cancer cells, blocking growth signals, or tagging cells for destruction by the immune system. Adverse effects. Adverse effects vary depending on the specific antibody but may include infusion reactions, immune-related adverse events, ERAs, such as dermatitis or colitis, and, rarely, cytokine release syndrome, CRS. C. Immune checkpoint inhibitors. Indications: immune checkpoint inhibitors target regulatory pathways, e.g., PD1/PDL1, CTLA4, to unleash the immune system's ability to recognize and attack cancer cells. They are used across various cancer types, including melanoma, lung cancer, and bladder cancer. MOA: by blocking inhibitory signals, these agents enhance T-cell activity against cancer cells. Adverse effects. D. Antibody-mediated tumor T-cell bridging therapies. Indications: bispecific T-cell engagers, BiTEs, and immune-mobilizing TCRs against cancer, IMMTACs, are novel approaches to redirect T-cells towards cancer cells, offering potential treatments for hematological malignancies and solid tumors. MOA: adverse effects. Adverse effects may include cytokine release syndrome, CRS, neurotoxicity, and infusion reactions. E. CAR T-cells. Indications: CAR T-cell therapy involves genetically engineering a patient's T-cells to express chimeric antigen receptors, CARs, targeting specific antigens on cancer cells. It has shown remarkable success in treating certain hematological malignancies, including leukemia and lymphoma. MOA: CAR T-cells recognize and bind to cancer cells expressing the target antigen, leading to their destruction. Adverse effects. Adverse effects include cytokine release syndrome, CRS, neurotoxicity, CAR T-cell-related encephalopathy syndrome, CRES, and cytopenias. F. Immune-enhancing oncolytic viruses. Indications: oncolytic viruses are engineered to selectively infect and replicate within cancer cells, leading to their destruction while stimulating an immune response against the tumor. MOA: these viruses directly lyse cancer cells and induce an immune response against tumor-associated antigens. Adverse effects. Adverse effects may include flu-like symptoms, inflammation at the injection site, and in rare cases, immune-related adverse events. Miscellaneous considerations. Combination therapies. Many cancer immunotherapy agents are used in combination with other treatments, such as chemotherapy or targeted therapy, to enhance efficacy. Biomarkers. Biomarkers such as PD-L1 expression or tumor mutational burden may help predict response to immunotherapy and guide treatment decisions. Cost and access. Immunotherapy can be expensive, and access to these treatments may be limited in certain regions or healthcare systems. Conclusion. Cancer immunotherapy represents a promising frontier in oncology, offering new hope for patients with various types of cancer. Understanding the indications, mechanisms of action, adverse effects, and miscellaneous considerations of different immunotherapy agents is essential for optimizing treatment outcomes and managing patient care effectively. Further research and innovation in this field hold the potential to revolutionize cancer treatment paradigms in the years to come. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video.